So what you see, of course, is our traditional silo style of learning. Anatomy in one semester, maybe range of motion, MMT in the same semester, then ortho, cardiopulm, neuro, all of these contents siloed. And inevitably we are trapped in, and we have to learn to work around the semester or quarter system. So there's no question about it. So every new class really becomes a desperate sprint for survival. So right, here are your new resources. Here are your new books. These are the things I'm going to teach you this semester. In our program, the students have access to PhysioU from the first day of class so that we can leverage the content from the very beginning of the program and begin to, I think of it as graded exposure. They get to see things and connect things all along the way. So we found that in the early years, a lot of our students were very disconnected. A lot of the foundational content was disconnected from the clinical classes. They were too far separated. Us instructors had not communicated well on how to bridge that gap. And so one of the things we tried to do was the gross anatomy instructor said, hey, can you help us link to some of the clinical classes to make gross anatomy more engaging and actually to pre-expose the students to interesting content? And so actually my colleague Eric Fulmar out of Northeastern, he said, hey, our class, gross anatomy, is directly tied to our range of motion, MMT, and palpation class. So I wonder if we could build that bridge. And so, sure enough, in our class, in our gross anatomy, I think in his program as well, when you are talking about soft tissue and bony structures, even within your syllabus or your handout, you can directly link to URLs that have the palpation of the bony prominences and the soft tissue videos that they're going to learn in class.
When palpating pectoralis minor, I'm going to have the patient in a supine position. I'm going to go ahead and elevate the shoulder to approximately 90 degrees, support at the elbow. I'm going to come in and palpate the coracoid process.
So what you can see here, actually lower on the screen, is we've also integrated origin, innervation, and action, so that origin, insertion, innervation, so that it links back and forwards to gross anatomy and their clinical skills 1 course. So all of the MMT, the range of motion, the palpation, all available in the range of motion MMT app. So this is one of the apps within the entire PhysioU series or suite of apps. We also thought that it would be really cool to link gross anatomy to orthopaedics, to basically say, hey, you're looking at all these cool source tissues, these structures. Wouldn't it be cool to learn a little bit about the conditions that we're commonly going to see in the clinic? So what you see here is an email that goes out to our students, and these are auto emails. This we can set up for your programs as well, so we know what joints are happening at what week. And so they get this auto email that says, hey, I know you're studying about the knee. Do you want to learn a little bit more about the common conditions? And so we nicely, of course, all of these are linked to the clinical practice guidelines. So we kind of begin to feed that into their mind. And they can click on these 1-minute videos and go, oh, knee osteoarthritis, yeah, I remember that problem. I know someone who has that problem. They can watch a little clinical finding video of an elderly adult who's having pain in the knee region, who's having stiffness and a lack of range of motion, and pain with transitional movements. So a lot of these videos I will revisit in ortho, but they're watching it just because it's fun to learn. And it also kind of pre-exposes the student to some of the content within the app so that they can explore if they want. So we're building patterns from the beginning and adding that clinical relevance into gross anatomy. The same thing when they're talking about different structures. We have chosen a few key conditions that we think they would really like to learn a little bit more about, just sprinkle a little of that in for their learning excitement. And so you can see that talking about the ACL problem, linking that to some tests that they may have seen in the past so they can explore it if they want. None of this is graded. This is purely for their joy of learning. Right? And looking at the video, pre-exposing them to the content, we think makes their learning that much more engaging. Any comments or questions about that?
Hello, can you
Hi.
hear me?
Hi,
Yes.
hi, Emil.
Hey, hello. The email, that's a very nice touch. I was just curious, is there a way to track how many students open the email? Like with other...
We can because we use MailChimp.
Oh, it's MailChimp. Okay,
So we
that
use
means-
MailChimp to do it. We are working on a better platform that will allow faculty to actually send those types of emails out or schedule them. But for us, in our program, and we could do it for you as well, we use MailChimp as a way to deliver it, Monday, Wednesday, Friday. They get an email. It's not graded. Just enjoy the learning.
So I'm curious, what's the opening rate you get with your students? That's
We
very
had
cool.
we had about a 60% opening rate.
Wow, that's impressive.
So
Yeah.
it's impressive. I think it's because I get to go in there at the first day of class and say, hey guys, we are going to try to enhance your learning and make things interesting for you. So I think how the professor couches the experience and gives them a reason why these things are being done will actually invite them into the content. Unlike if you just delivered another random email and they just didn't get why you were doing that and felt like it became an extra burden.
Yeah.
I would also say that many of our students after the first year said, you know what, could you put us back on that email list? Because now we have more time, we also want to see those things again. So I think there's this process of graded exposure that they can only handle so much at a time.
Very nice.
Michael,
Yeah.
Matt also has a question, and he's asking, how can our program use the email system?
Yes, so for example, later I will show you where, or for example, I can show you right now where we house that content. So at PhysioU, under Knowledge Central, from anatomy to discovering the patients. So we have this whole list of hip pain, lumbar pain, ankle and foot pain, elbow pain, shoulder pain. All of these are the emails that we sent out. So one way is you could link this URL directly into your syllabus. Or you can kind of touch base with us and we can easily set up. So we'd look at your syllabus and go, okay, let's send this series of emails out during these weeks, and it just becomes fire and forget. The students just get it. The faculty never has to worry about it. And then you can just test it yourself to see if the students really found it valuable. So that's how I would suggest. You could either reach out to us, or you could just come here and copy the URL and build that into your lecture. So this is kind of me experimenting. The reason why I did this was because I wanted to invite the students in the early parts of the program, one, to find context, to find meaning for what they were studying in anatomy as well as range of motion MMT. And I wanted to pre-expose them into the app world, because when we get to ortho, it's overwhelming. There's so much stuff, new thinking going on, that it would have been nice if I could kind of trickle it into their reality early on. So that was actually my secret reason for trying to do that. So you can see on Monday, actually Sunday night, they get clinical pattern recognition knee pain. So they're going to get, here is a bunch of patients that you can watch, 1-minute videos, so that you can go, oh, these are the patients. Cool. Yeah, I had that problem. So that's where that is. Then from here, on Monday, Wednesday, and Friday, they got 3 conditions. IT band syndrome, because we think they'd be interested in it, ACL, and then medial and lateral meniscus tear. We actually made more, but we figured there was just enough was enough. Too much was too much. And so now they could go in, learn about the structure, the pain pattern, learn about the structure, look at some tests that they may have seen before, and just expose themselves to it. And that would set the stage for the future. So let me take us back here. So Manny, if you want to talk briefly about how the techniques for labs have enhanced your classroom, and I'll also talk about how we use it in our program.